Many affected by the opioid epidemic have told us they're frustrated by what they see as a lackluster response from Washington.
Easy to accuse lawmakers of being out of touch, but I had a chance to speak with one member of Congress who knows the stakes of this crisis all too well.
It's interesting to be living through this because I do know what the impact is on a family of someone with a drug problem.
On many issues, our congressional representatives have to do their homework, talk to constituents, drill down on matters that might be a little foreign to them. But on the opioid crisis, Congresswoman Debbie Dingell has more than enough personal experience to guide her. Too much, in fact, starting with her father.
I lived in a household with someone that had an opioid drug addiction before anybody ever talked about it or ever understood that prescription drugs could be dangerous. I had a sister who died of a drug overdose. And I live with a man who doesn't like me to talk about it, but is in chronic pain. I mean, I just had him in for a shoulder x-ray and sonogram, and the collarbone was gone. It's bone on bone. He lives in pain every single day.
And therein lies the juggling act for crafting policy, trying to stem the addictions that plagued her father and sister, and yet respecting the pain management needs of those like her 91-year-old husband and predecessor in Congress, John Dingell.
You know, this isn't an easy subject to talk about because I've really lived with both sides of it.
As a child in St. Clair, Michigan, she didn't understand that all was not right in her house.
I mean, I thought it was normal to have a parent that would sleep all day and be up all night.
And if that had been the extent of the backwash on the family, it probably would have been fine. But in the middle of the Democrats' sit-in over the debate on gun control, the truth spilled forth on the House floor of what it was like for young Debbie Dingell to grow up with an addict.
But I lived in a house with a man that should not have had access to a gun.
Yeah.
I know what it's like to see a gun pointed at you and wonder if you were going to live. And I know what it's like to hide in the closet and pray to God, do not let anything happen to me.
Her father eventually made it into a drug treatment program, but not until after it had cost her parents their marriage. And agony would visit the family years later.
Mary Grace was our baby sister, and we loved her with our whole heart and soul.
Her younger sister, Mary Grace, perhaps most traumatized by the pains of her childhood, started using drugs in her teens, and they finally killed her in an overdose at the age of 40. That was after years of attempts at rehab. And while her father suffered by the stigma of a problem no one talked about, Mary Grace was just as tormented by a drug problem that lived in the open.
And we did everything we could to save her. There is nothing that I think I didn't experience in those decades of trying to save her.
Mr. Speaker.
And now, after all of that, she labors in the building that debates and creates the nation's health care.
It's very complicated.
Complicated. Time and again during our conversation, the Congresswoman returned to that word. It is deeply complicated. To clamp down on the rampant distribution and use of opioids, while at the same time appreciating that those turning to the drugs are in pain.
We need to make sure that we don't stigmatize people with a legitimate need for pain relief. Here's the challenge. How do we make sure that people who have a legitimate health need are able to have what they need and to be taken care of, and at the same time not promote a drug habit or drug problem?
In the middle of America's debate on health care, Dingell wonders if we've given up too much by moving away from an iconic staple, the family doctor.
Unfortunately, what's happening between insurance companies and complicated healthcare systems, there isn't a family doctor anymore, and I quite frankly am becoming more concerned about that.
We definitely appreciate Debbie Dingell's candor in that conversation. Really.